As we've built our patient-centered medical home over the years, one of the things we've done, again, is really think through all aspects of care that's needed, but not only from the medical component or thought, but also all of those wraparound services, social determinants of health that really impact 80% of a person's health in the first place. So housing and food and transportation insecurity, other things like legal services, and so many other things that impact a person's well-being and health. How do we build a system of care and a system of wraparound services? How do we partner with entities that could bring all of those services to bear that really become barriers to improving the health status of our community? The Daughters of Charity came to this community years ago, really focused on working in community. And so even back when they arrived in 1830 and started working in healthcare, the Daughters of Charity actually started working and fighting yellow fever outbreaks and other types of plagues in the community. And so there's always been this focus on the sisters working in community, going where patients are, where individuals are, and actually assisting where needed. The original plan was to open 5 health centers around the city of New Orleans. And they started looking at the neighborhoods that had I guess they would be called health deserts, or areas that don't have primary care and preventive services. And the first one was built in the Holly Grove Gerttown community at the old Carrollton Shopping Center. They converted what was called a Western Auto facility across from Xavier University, and it was in a strip mall. They converted that into their first health center. Hurricane Katrina came and destroyed that site, and that set out the journey to relook at, reestablish, rethink about how services could be done throughout the entire community again, and strategically think through how to position ourselves to grow primary care and prevention to a size and scope that their city really needs.
Some of the partners that help us to address social determinants of health are our New Orleans Housing Authority, the Total Community Action Program, which may provide housing assistance, rental assistance, assistance with paying utility bills, some social service organizations that have been developed to specifically address specific topics. The one great thing about the AIM CCI project is that it afforded us the opportunity to bring partners together at one table for the same cause, and that was to better provide maternal health services to the women of the greater New Orleans area. We had individuals coming to the table that we just did not think about, who needed to be at the table. Whether they worked in policy change, whether they worked in state operation, private agencies, community health centers, public health centers, hospital settings, we were all at the table. Rather, I say we are all at the table. When we actually started the AIM CCI initiative, one of the key things that we talked about was the need to have extended Medicaid coverage for the woman during that postpartum period. Louisiana has stepped up to the plate and said they agree. And so now women are able to receive postpartum coverage a year past the delivery. One of the elements of the AIM CCI project is health equity. And in that element, women were taught, are being taught, that you have a voice in your health care. Not just you, but your significant other as well. You have a right to ask questions. If something is unclear, stop that visit. Tell the doctor, I don't understand the terminology that you're using. I need to understand what's going on with me, my body, and the baby that I'm carrying.
The population that we serve here at DePaul Community Health Centers, we do have a lot of Hispanic patients, especially with the maternity department. We also do serve the African American population, as well as a maybe 1% of Arabic population.
The provider mindset here in New Orleans, I will say that providers tend to impart their biases on patients a lot of times. A lot of times, providers see their patients as being one type of person when there are multitudes of different people in the world. So it's important to keep in mind your own biases as well as what the patient actually needs, because you can't treat every 2 patients the same. Here in New Orleans, and especially at DePaul Community Health Centers, we more so tend to focus on those underserved populations. So maybe the person that does not have the most money, or the person who often gets overlooked in the healthcare process. So that's why we team up with research organizations such as All of Us to try to include those people into the healthcare system so we can treat them fairly.
Some of our providers' mindset as far as serving the Latino population, we have a different culture, so therefore our medical treatments, we expect different. We expect it to be different. And here at DePaul Community Health Center, the providers are very well trained, I could say, or they very well knowledgeable of our culture. So they try to fit the program accordingly to how the patient, wants to deal with it.
How do I define postpartum care and when do I start it? Postpartum care obviously is after the delivery of the baby, and it starts immediately after delivery of the placenta. And I start postpartum care at the first prenatal visit. And we do this we start already supporting and encouraging breastfeeding. And we start looking at the patient's history and listening to what our patients say so that did she have previous blood pressure problems in a previous pregnancy? Did she have postpartum hemorrhage? Does she have anemia? Has she been on iron? How heavy are her menstrual cycles? So you even start early from the first day, gathering information that will help you provide better postpartum care and anticipate things that might come up during the postpartum period. We have a community navigator that comes in and interviews every woman, and not only does she get the information from the patient, she also communicates with me so that I know what's going on, and then we turn that around and also communicate with the social services and behavioral health. I think we as providers need to be more opening to hear where the woman is and what she's perceiving her health care to be. And if we can integrate that with what our findings are, and both of us work together on a decision-making process, I think that is a better outcome for most women. But I do think they have a really good knowledge about who they are. They just haven't unleashed it yet because people haven't really listened to them. And it's awesome to see a healthy baby and a healthy mom. And you have hope for their future when you see that.